Alex Sobel.
Thank you, Mr Hosey. It's been a year now since hospital beds started filling up. Since then, there have been over 126,000 deaths. Our mothers, fathers, brothers and sisters, our friends, neighbours and colleagues. In the NHS, more colleagues than most. Last night, like so many others, I reflected on a heartbreaking year of loss. But while last year has been tragic, it has not been unavoidable. Implementing the first lockdown just 1 week earlier, as advised, could have halved the early mortality rate. Our hospitals and NHS staff have weathered a storm of the government's making. Let us cast our minds back to March 2020. It seems implausible now that the Prime Minister was boasting about shaking hands with every person he met on a visit to hospital with COVID-19 patients. Edwina Currie compared him to Princess Diana. Others were less favourable. It's been revealed by the BBC this week that the Prime Minister said the best thing would be to ignore the virus and that overreaction would do more harm than good. But the NHS is facing immense challenges, the overcoming of which will be fundamental to its very survival. There is the pandemic, of course. Then there is the small matter of rolling out the most ambitious vaccination programme in the nation's history. Our NHS have not only been asked to bear the brunt of this pandemic, they've been forced to do it with one hand tied behind their backs. February this year, NHS hospitals, mental health services and community providers reporting a shortage of nearly 84,000 staff. 38,000 of those vacancies were for nurses, the enduring backbone of our National Health Service. A decade of underfunding, lack of accessible training and failure to prioritise our healthcare workers has hit the NHS hard. But the Minister knows this. It is a situation of government design. The NHS is sick. It is underfunded and understaffed. Just as a sick patient is not aided by removing their medicine, the NHS will not be healed by cutting the pay of its workers. The government, its spin doctors' praise for the NHS has been almost evangelical. We've seen the Prime Minister on our TV screens clapping. We've heard Tory ministers refer to NHS workers as heroes and angels. We saw the hyperbolic outbursts reach fever pitch when the Health Secretary cried on national breakfast television. Most NHS workers I know have no desire for constant praise and adoration. They don't want to be called angels. They are skilled professionals, have worked and are working through a deadly pandemic. Most would be happy for their hospitals to be properly funded, their patients given the best chance of survival, and finally, a pay packet which reflects their workload. To cry hero, then cut pay, is as manipulative and cruel as it is unsurprising for a party that has systematically sought to undermine our health service and its workers. The NHS has done so much more than just jobs during the pandemic. They have risked their lives every single day for our most vulnerable. They have held the hands of loved ones in their final moments when they could not. They have been a bright flame of hope during a year filled with anxiety and fear. NHS workers have given us more than we can ever give back. Their compassion and bravery and will is something we may not ever be able to fully repay, but recognition of their work can be fulfilled by a decent pay rise. Thank you.